Welcome to our weekly COVID update, and I'm joined today by Paul Morrison, our Director of Bylaw, Dr. Lawrence Lowe, our Medical Officer, Health and Peel Region, and MP Kamal Kara. I want to start off by speaking about outdoor amenities. I wanted to highlight that I was grateful that the province listened to our request to lift some of the restrictions that were among the most onerous in North America. And as of this weekend, we were permitted to open up our golf courses, driving ranges, soccer and other sports field, tennis, basketball course, lawn bowling, bocce, BMX and skate parks. I would note that team sports are still closed and outdoor pools are closed. So this is positive that they lifted some of the restrictions. I would love to see more of these outdoor restrictions lifted, given the fact that that has been the clear medical advice from the Ontario Science Table. But progress is good, and it was great to see these facilities so widely used this past weekend. We had all our facilities immediately opened once we were given the provincial go-ahead, and I can tell you that they were widely used because people want to be outdoors. They want to get fresh air, and so that was wonderful to see, including the last-minute correction by the province to open splash pads. With the warm weather, it just was a no-brainer, and so thank you to the provincial government for listening to that call from municipal leaders across the province, and hopefully we'll see the other restrictions on outdoor amenities lifted as well. In terms of vaccines, we've also had some great news in Peel Region. We have now passed a very impressive milestone, over 1 million doses administered across Peel. And we are rapidly approaching our interim goal of 75% of adults vaccinated over the age of 18. Currently, we sit almost at 70%. I think it's closer to 69%, but those are big numbers. And vaccines pave the way to getting back to normal. And so when you see numbers like this, it's no wonder you're seeing case counts decline so rapidly. The provincial hotspot strategy worked. Paying a focus on the hotspots allowed us to get the situation under control. For the first 2 weeks of May, we had allocations that were almost double our per capita population. I would note that there's one caveat in that good news, and that's that the hotspot strategy is over. We are now receiving for the next number of weeks below our per capita allocation, which puts a strain on Peel Public Health, but we're looking at efforts to mitigate those decreasing supply numbers. But I can tell you, during the period that we did have the focus on the hotspots, we made incredible progress in terms of vaccinating our vulnerable essential workers and really getting vaccines across the board in Peel Region. I also want to thank all the unsung heroes that helped us set up a variety of pop-up clinics and different outlets for the public to get their vaccines, whether it was with labor groups, whether it was multilingual clinics, whether it was community organizations, faith-based organizations. We had an effort across the board to get the community vaccinated, and it was so impressive to see everyone step up. If you need to book a vaccine and for some reason haven't done so already, you can simply call the Region of Peel COVID-19 vaccination line at 905-791-5202 from 8 a.m. to 8 p.m. 7 days a week. Booking online is obviously the quickest, but you can certainly call as well. In terms of an Osler update, William Osler Health System continues to be strained by the burden of COVID-19. But the picture is slowly, and I'd say slowly, getting better. For this week, there are currently 53 COVID-19 patients at Brampton Civic Hospital, including 10 in ICU. There are a further 35 COVID suspect patients who are awaiting test results, and we continue to have to transfer patients elsewhere. So the coast is not clear in our hospital, but we are making progress. In terms of a bylaw update, our bylaw officers were busy on the weekend, unfortunately. We had to lay 7 charges under the Reopening of Ontario Act. And so I'm just going to ask everyone, please listen to the public health guidelines. There are provincial rules on how many people can be at an outdoor gathering, and please respect those guidelines. And listen to a bylaw officer or a Peel police officer when they come to offer guidance on what is an allowed gathering. Other than that, I'm grateful that everyone is doing their best to collaborate with the public health guidelines. We are making real progress in Peel Region. And one of the reasons for that is we're all working together, whether it's City Council working together, the provincial government, the federal government, everyone is working towards the goal of getting out of this difficult pandemic. And one person who's been an unsung hero has joined me today for my press conference, and that's MP Kamal Kara. She is an MP by day doing her job representing her constituents, but one thing that I found so impressive is she's also been spending her weekends vaccinating residents. So her previous training as a nurse equips her well to help residents, and she has been working in a number of our clinics, including the Brampton Islamic Center pop-up clinic and now at the Civic Center, and I'm grateful for her dedication. It really is beautiful to see that everyone is chipping in to help get Brampton out of this COVID-19 challenge. And so on that note, I'm going to invite Kamal Kara to share a few words about her efforts vaccinating residents and additionally why it's important to get vaccinated.
Well, thank you, Mayor Brown, for those kind words, and allow me to first wish you a very happy birthday, and thank you for inviting me here today. Good morning, everyone. I am Kamal Kara, proud Member of Parliament for the beautiful riding of Brampton West, and it is great to join you this morning. Let me start off by sharing an important milestone that deserves to be acknowledged and celebrated. And that is that as of this past weekend, more than 60% of Canadians over the age of 16 have received at least one dose of a vaccine. Another significant milestone in our community is that over 1 million first doses have been administered in the region of Peel. And I just want to take a moment just to thank all the people who have made this milestone possible and made it a reality. From governments working together, from our federal government, who's procured over 25 million doses so far, to Peel Public Health, to our hospital partners, to healthcare professionals, pharmacists, nurses, doctors administering vaccines, and to community leaders and volunteers that are stepping up. It is because of your hard work and your dedication that has made Canada a leader in vaccinations on the international stage and third most vaccinated country in the G20. Moving forward, Canada will continue to receive millions of vaccines every week, and by the end of the summer, every single Canadian who wants a vaccine will be able to get one. As Mayor has mentioned, as a proud registered nurse myself, I've been spending my weekends at clinics in Brampton vaccinating community members. And I have to tell you, it has been so inspiring to see so many Brampton residents doing the right thing, stepping up and getting vaccinated. So to all of you that have gotten your vaccine, thank you for doing your part in keeping our community protected in the fight against COVID-19. What's even more exciting is that over the weekend, we started to vaccinate youth age 12 and older. And I can't tell you how inspiring it has been to see young Canadians in our community stepping up to book their vaccine and proudly taking their shot. So if you're over the age of 12 and up, you can book your appointment, as the Mayor has said, do your part, get your shot. It is easy, quick, and it will get us that much closer to beating COVID-19. At a moment, there have been, as has been mentioned, there are many vaccination clinics in Brampton, along with many community-led clinics and collaboration with Peel Public Health. All the information can be found at the Region of Peel website. So I encourage each and every one of you to book your vaccine, get your shot, and let's move one step closer to beating COVID-19 together. Thank you.
Okay, well, thank you, Kamal, for your dedication serving our residents in Brampton. Next up, we're going to hear from our medical officer health, Dr. Lawrence Lowe, who has been also incredibly dedicated to protecting the health of our residents in Peel Region.
Thank you, Mr. Mayor. Good morning, and good morning, Member Kira. And thank you both certainly for your leadership and contributions. Thank you, Member Kira. I didn't realize that that Member Kira was vaccinating at our clinics here in Peel over the weekends, but we are grateful for that support in addition to the leadership provided by all of our leaders here in the region of Peel. This week, Brampton's test positivity sits at 12.7%, with a weekly incidence rate of 232.6 cases per 100,000, both down from last week. Our hospital picture is also slowly stabilizing, though admissions are still volatile, with numbers fluctuating daily. Local hospitals and ICUs still have many admitted patients, which is necessitating continued transfers and pauses on surgeries. And it's for this reason that I welcomed the gradual reopening approach announced by the provincial government last Thursday. I appreciated the caution that supports the goal of preventing any resurgence of COVID-19 and the flexibility to carefully revisit measures if indicators improve sooner than expected. It was good, indeed, to see many people outdoors in the past weekend, enjoying playgrounds and activities while sticking to the precautions. That said, sticking to the precautions is still vital. The reality is that when and where cases surge, people will often need hospital care sooner than the current patients are healing and leaving the hospital. So it's important to continue limiting contact through masking and distancing and favoring the outdoors as much as possible. And where you can, please get vaccinated. On that note, our vaccination program continues to hit milestones here in the region of Peel. On Monday, we surpassed 1 million doses administered. Today, we are rapidly approaching 70% first dose coverage for our 18-plus population. I anticipate that milestone to be confirmed today or in the days to come. And that also includes 75% first dose coverage for those aged 50 and over half of our 18 to 49 with first doses. The province's hotspot allocation has worked, and over the first 2 weeks of May, it has allowed us to advance our plan and bring our capacity online in very short order to get this hard-hit community vaccinated. That capacity delivered a record 170,000 doses in a single week last week through efficient mass immunization clinics and targeted outreach strategies to reach our most vulnerable. And that capacity continues to grow. Today, supported by Bruce Power, we are opening at the CAA Centre in Brampton, starting with a vaccine hub focused on youth. This hub will support our continued efforts to provide first dose protection to those aged 12 to 17 in our community. I'm hopeful that with first dose coverage for teachers and for the students of these ages, this will ensure that our youngest residents are able to eventually derive the benefits of in-person learning sooner rather than later. Now that the provincial hotspot strategy that brought increased vaccines to Peel has expired, however, we will be scaling our clinic capacity to match the per capita allocation that continues to be provided by the province. We understand that this will allow the rest of Ontario to push forward in reaching provincial first dose targets. The hotspot strategy has gotten us very close to 75% first dose coverage, and we are hopeful that this will continue to limit severity and mortality going forward. However, as we move towards a gradual reopening, I'm hopeful that the province will move quickly towards opening second doses and welcome clarity on a plan, as well as any additional allocation and flexibility to continue prioritizing hotspots such as Peel to make the use of our developed capacity in the best way possible and in line with the Ontario Science Table's recommendations. Moving quickly to second doses in Peel and other hotspots will help to seal the deal and accelerate our return to a new normal with confidence not only here, but across Ontario. And I can say with absolute certainty that we all want that. So in the meantime, I urge all of our residents, if you have not yet received your first dose, please visit peelregion.ca/COVID-19 vaccine to learn about all our offerings and to book today. For those of you who have had their first dose, thank you. And please stand by for further information on how to get your second shot. And finally, please continue to follow the precautions and stay safe as we attempt to bring all of this acute phase of the pandemic to a conclusion. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. On that note, we're happy to answer questions. We have a question from Nitin Chopra from Prime Asia TV.
Good morning. My question is to Dr. Lowe. Dr. Lowe, what advice you want to give to the cancer patients, because their immunity is very low? Should they get the vaccine? If yes, then which? Pfizer, Moderna, or AstraZeneca? Because many cases came forward where they had some complications after getting the vaccine. So what is your advice to cancer patients?
Thanks, Nitin. I think there's a few questions there. So in respect of cancer patients, there's no specific vaccine that is recommended for them. I certainly continue to advise and recommend that people get whatever vaccine is offered to them. We do know that certain cancer patients are eligible for an accelerated second dose schedule, and so I encourage them to visit peelregion.ca/COVID-19 vaccine to learn of their accelerated second dose eligibility, and then to call our call center if they are eligible to book. In respect of side effects, there are no, typical side effects are, mild fever, pain in the arm, redness at the injection site, etc. There are no specific side effects that are related to individuals who are cancer patients and who may receive vaccines. And on that note, I would mention as well, getting the first vaccine is crucial because every moment that you wait is a moment that you're unprotected, that you may contract COVID-19 and therefore present a challenge to our healthcare system in the event that you have a severe presentation, or worse, be faced with mortality. So I encourage everyone to get vaccinated, and certainly for cancer patients to review whether they are eligible for accelerated second dose strategy by visiting our website. Thanks for the question.
I have a follow-up for Dr. Low. Dr. Low, if someone gets infected, for how long the virus remains in the body? Is it 90 days or still more? Or after that, do anything they have to do, or the virus goes away automatically from the body?
Thanks for the question, and this is a really important question, and I'm glad that you asked it. In general, once someone has been infected by COVID-19, we consider the infection cleared as of 10 days after the onset of symptoms or after a positive test. After those 10 days, the individual should return to continuing with normal precautions, making sure that they're distancing, etc., and they should get vaccinated. I have heard questions, people saying, well, I've gotten COVID before, I don't need a vaccine. We don't know how long natural immunity lasts with COVID-19. There's indications that people who have had COVID-19 previously can have even more severe presentations with a reinfection. So if you've had COVID-19, if you are infected with COVID-19, please ensure that you're isolating for those 10 days. And then after that, please ensure that you seek vaccination as quickly as possible. Thank you.
Our next question is Nikki Cedroni from the Bramptonist.
Hi, good morning. Happy birthday, Mayor Brown.
Thank you.
My question is for Dr. Lowe. Now that children aged 12 and up are offered vaccinations, do you see this as a requirement before going back to school in September?
Thanks, Nikki. I mean, I don't, it's not necessarily a requirement within provincial statute at this point in time. And so certainly I imagine the ministry will be looking at all these questions around the need to have proof of vaccination for all sorts of activities, including school return. We do know that there is a requirement for individuals to show immunization for the purposes of school entry for many other diseases, or to sign an exemption. So I think that may be part of an ongoing discussion. But at this point in time, I think just from a scientific perspective, my encouragement is for everyone to access the vaccine protection as quickly as possible. Thanks so much for the question.
Thank you. My next question is for Dr. Lowe also. Some people are vaccine hesitant. Could this affect herd immunity?
So certainly, Nikki, we know that there are lots of people who have questions around the vaccines. We do recognize they are new vaccines. They are, and it's still a new disease. For those who have questions, I encourage them to visit our website, peelregion.ca/COVID-19 vaccine. There's plenty of other resources also put out by our provincial and federal partners, as well as many other grassroots community efforts to really address vaccine hesitancy. We are trying to build vaccine confidence here in Peel as well through our outreach strategies. We have, for example, various clinics that are targeted at ethnocultural or faith groups in our community that have popped up around, certainly the Bramalea City Centre Clinic. We have the South Asian Task Forces Clinic at Embassy Grand. And so we will continue to work with the community to encourage vaccine confidence. And I encourage anyone who has questions to visit the many resources that are out there and really be assured that getting the vaccine is the best way to protect yourself, your family, and your community as quickly as possible. Thank you.
Well, thank you, Dr. Lowe. And I would just add to that, both the City of Brampton and the Region of Peel are running our own campaigns, social media campaigns that will be beginning within the next week to encourage residents to get vaccinated, to protect their friends, family and loved ones. And I can tell you that those campaigns will be targeting every aspect of Peel Region. We haven't seen vaccine hesitancy yet, but that's not to say we're not going to see vaccine hesitancy. Right now, there are a long list of people that want to get vaccinated, and that's why our clinics have been so busy. But as you get higher and higher, if we get to 70%, then eventually 80%, I think the higher the number that you get in terms of the percentage of the population vaccinated, that's where you'll start to see potentially some hesitancy, and we're prepared for it. But I believe the vast, vast majority of the public understands that vaccines protect you. Vaccines pave the way to getting back to normal, and I appreciate the fact that our residents have taken to heart the advice of our physicians and the national advisory panels that have shown very clearly that the vaccines are in their best interest. On that note, this completes our weekly COVID-19 update. I want to ask everyone to continue to follow our emergency protocols, the provincial emergency protocols, listen to the advice of public health, and we're so close. This is kilometer 41 of a 42-kilometer marathon. We are so close to the finish line. There are better days ahead. We just need to do this final push, and thank you to everyone who has pitched in to help Brampton get through this difficult year.